Abdominal aneurysms are pretty common, especially AAA, abdominal aortic aneurysms are very common. In that case, you need to know how the procedure is being treated, because an aneurysm can also be treated as an open approach or as an endovascular approach. Just figure out what is the vessel that is being affected and what is the approach. Is it open or endovascular? Once you figure out the vessel, then you will have to know the type of graft that is being placed. You should understand the coding of these aneurysms and vascular graft and all that comes within the domain of interventional radiology, meaning IVR coding. What you need to know is a basic understanding of these aneurysms, because this is a preparation for the basic certification. We also have the specialty credential of IVR. There you need to know the complete anatomy or the altered anatomy, the type of graft, the name of the graft, because according to the name of the device, the code varies. So when you be in constant touch with modern improvements and upgradation, then we can figure out the type of graft.